Hello, my name is Abbas Sghab, and today we're talking about the laparoscopic surgical instruments and usage. So, laparoscopic surgery. A laparoscopy is a type of surgery that checks for problems in the abdomen or our reproductive system. Laparoscopic surgery uses a thin tube called a laparoscope. It's inserted into the abdomen through a small incision, and incision is a cut made through the skin during surgery. The tube has a camera attached to it. The camera sends images to a video monitor. This allows to view the inside of the body without major trauma to the patient. Laparoscopic instruments. Many instruments are similar to those used in open surgery, adapted to fit through narrow ports. Placed through the skin, laparoscopic work is then conducted via the ports. Here we can see the camera and the lens. The camera is hand-held component and connects to a variety of lenses. There are usually settings for focus and white balance. Here we can see the light source, fiber optic cable connect to lens and eliminate field of vision. Caution around internal structure as light output can be hot. And then there is the varus needle. One method of achieving a pneumoperitoneum consists of a blind placement of needle into abdomen and subsequent injection of gas. Trocars, transabdominal working ports where laparoscopic instruments are inserted, also for insufflation or removal of specimens. Available in multiple sizes, example 10, 5, and 12 mm. Laparoscopic instruments, hand-held and shafted implement used to work through trocars, can perform grasping, retracting, cutting, and cauterizing and other functions. Where we will use the laparoscope or laparoscopy. For people with abdominal symptoms, laparoscopic surgery may be used to diagnose tumor, for example, any blockage or obstruction, unexplained bleeding, to detect the source of the bleeding, infection, and for women it may be used to diagnose and or treat fibroids, growth that from inside or outside the uterus. Most fibroids are non-cancerous, benign tumor, ovarian cyst, fluid-filled sacs that form inside or on the surface of the ovary, endometriosis, where we will have the tissue that normally lines the uterus grows outside of it, pelvic prolapse, which is a condition which the reproductive organs drops into or out of the vagina. Laparoscopic view of the patient lower abdomen. For example, tumor mass between the uterus and the bladder. Both ovaries are free of suspected lesion. The cyst was opened to remove the infectious fluid and revealed a solid foreign mass. The surgical sponge is removed laparoscopically. The surgical site after complete removal of the sponge. The intact bladder is seen in the deeper aspect after retrograde blue dye filling. The complete capsule of the tumor was removed and bleeding was observed in the wound bed. It may also be used to remove an ectopic pregnancy that grows outside of the uterus. Perform a hysterectomy, the removal of the uterus. Hysterectomy may be done to treat cancer, abnormal bleeding, or other disorders. Perform a tubal ligation, a procedure used to prevent pregnancy by blocking a woman's fallopian tube. Treat incontinence, accidental or involuntary urine leakage. The surgery is sometimes used when a physical exam and or imaging tests such as X-ray or ultrasounds don't give enough information to make a diagnosis. That's it. Thank you for your attention.